So although there may be people still joining us, I think it's only right that we make a start. I'm Steve Robertson. I work as a programme lead for a programme of research at the University of Sheffield in the UK. I'm also an emeritus professor at Leeds Beckett University in the UK and an adjunct professor at Waterford Institute of Technology in Ireland. And it's my pleasure today to be helping to chair this international event, which I know is going to be hugely exciting and interesting. So I'll start by doing some introductions. Most of you, I'm sure, will already know Peter Baker, whose report is going to be presented today. Peter's currently CEO of the Global Action on Men's Health and was previously the lead at the Men's Health Forum in the UK. I've known Peter, I think, since the mid-1990s, and I think it's fair to say he's been one of the leading proponents of men's health, definitely in the UK, but also internationally as well. So it's great that we're going to be able to hear about the report today. And then we've got two people who are kindly going to spend approximately 5 minutes each responding to the report and generating some discussion. The first of those is Dr. Rosemary Morgan, who is an assistant scientist at Johns Hopkins School of Public Health, which is part of the Department of International Health, but also holds a joint position in the School of Nursing. She's got expertise in gender analysis, intersectionality. She currently leads the Sex and Gender Analysis Core for a National Institute of Health funded project looking at sex and age differences in immunity to influenza. And she's also working on a Canadian Institute of Health Research funded project looking at the gendered effects of COVID-19 in Canada, the UK, China and Hong Kong, as well as coordinating an international gender and COVID working group. So a busy time, I'm sure, Rosemary. Welcome. And then the second respondent is going to be Dr. Noel Richardson. Again, I've known Noel for a long time. He's the director of the National Centre for Men's Health at Carlow Institute of Technology in Ireland. He was principal author of the first ever national policy on men's health, published in Ireland in 2009, and also on the follow-up National Men's Health Action Plan, which was published in 2016. He's worked as a policy advisor on men's health at the Health Service Executive in Ireland since 2005, and he's co-author of the first European report on men's health that was published in 2011. He's collaborated with the World Health Organization on the writing of the men's health strategy for the WHO European region. And he's a board member of the Men's Health Forum in Ireland and a member of Global Action on Men's Health. So thanks for joining us. We're going to just go through a few ground rules that will hopefully ensure everything runs smoothly. This is normally where I tell you where the toilets and the fire exits are. But given that we're all meeting virtually, I hope you all know where your own fire exits and toilets are should you need them. The presentation is going to last about an hour, and the plan is to have the report presentation by Peter lasting approximately 20 to 25 minutes. And then, as I say, Rosemary and Noel will each respond for roughly 5 minutes, and then it's going to be open to the floor. So the ground rules are, please stay on mute unless you're invited to speak. Most of the discussion is going to be done via chat, which hopefully most of you know how to work, but we will obviously be raising some of the more interesting points and getting Peter's, Noel's, Rosemary's and hopefully other people's thoughts as we go along. Video's off, apparently. And just to let you know that Global Action on Men's Health will be publishing a recording of the webinar. I'm keeping a copy of the chat for internal use only. And one of the things that Peter has asked me to do is whether you could all please introduce yourself on the chat by name and organisation. That way, Global Action on Men's Health has got a permanent record of who's attended. Also, to let you know, this is the first of 2 webinars that are pretty much going to be the same format, but with different respondents. The second one is going to take place on the 1st of July. Attending this one doesn't preclude you from attending the second one should you want to. But the second one is primarily meant for people in sort of Asia, Australia, New Zealand, because of time differences. I hope that was everything. The idea of today is really to get ideas about whether the report helps us to get men's health policy on the agenda. Does it do the job? Are the ideas in there the right ideas? And also, if not, what's missing? So those are 2 of the key things that Global Action on Men's Health is trying to get out of today. Are the ideas presented the right ones to try and get men's health policy on the agenda? And if not, what's missing? Okay, I think that's ground rules covered. So over to Peter.
Well, thank you very much, Steve, and hello everybody, and thank you very much indeed for joining this webinar. It's fantastic that there's so much interest in our reports and what we have to say, and I really look forward to hearing what you think about it. I must admit to being a little bit nervous because some of the ideas that I'm going to talk to you about are perhaps a little bit controversial in the men's health field. So it'll be interesting to hear what you think. So first of all, just let me say a few words about Global Action on Men's Health in case you don't know much about us. We were launched in 2014 and we became formalised as an organisation when we became an international charity registered in the UK in 2019. We currently have over 50 organisational and individual members, and if you are already a member in any capacity of Global Action on Men's Health, you are particularly welcome. And if you're not yet a member and would like to be after this call, we'd be absolutely delighted. So please get in touch by email and we can tell you how you can join the organisation. And our membership fees are extremely reasonable. Our mission is to create a world where all men and boys have the opportunity to achieve the best possible health and well-being wherever they live and whatever their backgrounds. And our main goal is to influence policy at the global and national levels. We're still a very small organisation and we're developing, but I think we're beginning to make our voice heard. And I think we have something interesting to say. So why are we here today? Well, first of all, I should have put this on the slide. This is Men's Health Week, in case you didn't know. And of course, being Men's Health Week and the 26th Men's Health Week, we had to do something. So we decided to hold a webinar and to publish our report. The report itself is launched on Friday, on the 19th of June. Now, you've all been sent the URL, the link to the report, but that's in confidence because the report is not yet publicly available, so please keep it under your hat for the next couple of days. Its publication on Friday will coincide with an article in The Lancet, which I've co-authored with Alan White and Rosemary Morgan. And it's a comment piece in The Lancet, and it really talks about some of the issues that we raised in the report, particularly the need for a policy response on men's health. And so please look out for the article, and when we tweet about it, please retweet it. So why have we produced this report? Well, probably don't need to tell most of you that men's health has historically been neglected despite men's obvious poor health outcomes. And it's always seemed rather strange to those of us who work in this field how little attention is paid to men's health despite the obvious problems. And it's almost as if men's health is an issue that's been hiding in plain sight. COVID-19, we didn't know COVID-19 was going to come along when we first thought about writing the report, but it certainly served to highlight some of the underlying problems in men's health. It's kind of shone a spotlight really on some of the issues that we have been talking about for years. And we know that COVID has placed a particularly heavy burden on men in terms of serious disease and mortality. Men have largely been absent from health policy at the global, national and local levels, and I'll say more about that shortly. And what hasn't really been looked at are the barriers to policy and the opportunities and strategies that may now exist for advocacy. These have not received sufficient attention in our view. So we've done a lot of moaning over the years about the lack of attention paid to men's health, but we haven't really sat down and thought about why that's happened and what we can do about it. And this report is an attempt to do that. It's not definitive. We're calling it a scoping study because it attempts to map out the issues, and it is very much for discussion. So what we'd like today is to hear from you about whether the kind of ideas that we're talking about make sense to you. Are we thinking along the right lines in terms of how we can push men's health onto the policy agenda, particularly at the global and national levels? And what might be missing? Is there anything that we should be doing or should be thinking about that we haven't yet thought about that might help us do better? So how do we go about putting this report together? Well, this is a summary of the methodology that we followed. We did a literature review. I have to say that didn't take awfully long because there isn't a great deal of literature about men's health policy to read about, but there is a bit more about gender and health policy in general. So we looked at what was out there and we tried to make sense of it, looking at it through the lens of men's health. We also did an original piece of research, which was to do 2 surveys of professionals in the men's health field. We did a general men's health policy survey, and we got 75 responses from 19 countries. And we did within the report, there's a case study specifically on prostate cancer, and we did a separate survey of people working specifically in the prostate cancer field, and we got 16 responses from 6 countries. We also did a number of semi-structured interviews with key informants, people who have been working in this field, who we thought it would be useful to talk to, and we interviewed 14 people altogether. So I think it will be, we certainly can't pretend that there hasn't been some progress in terms of men's health policy. We can't pretend that nothing has happened. And in the survey that we did of people working in the men's health field, 63%, almost 2/3 of respondents agreed that men's health now has a higher policy profile than it did 20 years ago. So clearly the perception is that there has been some progress, and these are some examples of what has happened at the global level. The WHO Europe Men's Health Strategy that was published in 2018 is perhaps the best example, because this covers 53 member states. It's purely advisory, of course. The WHO can't force its members to do anything, but the fact that it exists, that a lot of work was done to prepare it, a lot of people were invited to collaborate, including Global Action, I think is very, very significant. And it's a very good blueprint, a very good model for how men's health strategies could be developed at the international level. PAHO, the Pan American Health Organization, which is the WHO region for the Americas, last year published a report on masculinities and health, which again talked about some of the policy issues, and I think it has again helped to move things forward. The WHO's World Health Statistics for 2019 very deliberately set out to provide sex disaggregated data, particularly related to the Sustainable Development Goals. And I think that was very significant. The WHO in that report called for an approach to policy that is gender sensitive. And that was repeated in the WHO report on universal health coverage that was also published last year. That report specifically called for gender responsive national health strategies that are inclusive and address key barriers to access for women, men, gay men, lesbians, bisexuals, transgender and intersex populations. At the national level, there's also been some progress, and we know that there have been national men's health policies published in Australia, Brazil, Iran and Ireland. We don't know very much about the policy in Iran, but we know that it exists. We do know rather more about the others. And certainly in Australia and Ireland, there have been two versions of the policy. So in both those countries, men's health policies have had a relatively long life. And we can't underestimate the importance of these. We know that these policies are not perfect, but they have made a difference. In Ireland, which is perhaps the example I know best because I was involved in an independent evaluation of the first men's health strategy, it's clear that it has made a significant impact. And despite there being very little central government funding to support the policy, it nevertheless has had a big impact in terms of the development of community programs and professional training. At the local level, we've also seen progress in Canada, where Quebec has an action plan on men's health and well-being. We know that several of the Australian states have had their own men's health policies. In the American state of Tennessee, there's been the development of what's called the Men's Health Report Card, which has gone through several phases, several versions, and that's helped to collate and publish data about men's health and consider its implications for policy. And it certainly forms a model that might be adopted at a local or national level elsewhere. And in the UK, Leeds City Council has published a comprehensive men's health report about men's health in that city. This has led to several policy developments, including a range of initiatives to engage men, especially on the issue of suicide prevention. And we've also seen some progress on specific men's health issues. We've certainly seen over the last few years a big increase in gender-neutral HPV vaccination programs. And we now know that there are at least 40 countries around the world where both girls and boys are vaccinated or offered vaccines as part of a national HPV vaccination program. And this is hugely significant because it means that men will be much better protected against the cancers that HPV can cause in men. We all know, of course, that HPV causes cervical cancer in women. What's less well known is that it can cause anal, penile, and head and neck cancers in men. And the vaccination will protect men in the future against that. UNAIDS has produced an excellent report called Blind Spot, which looks at men's use of HIV services around the world and has a series of policy recommendations. And I know that in England, the Department of Health has developed a suicide prevention strategy, which has not a sole focus on men, but which includes a specific focus on men. So we have seen that in certain areas, men's health has received some appropriate and additional attention. But, and there's a big but, we know that men's health remains generally absent from policies and programs at all levels. And this is a quote from a recent journal article which was published in the Health Promotion Journal of Australia, which says that global health promotion, advocacy, research, policy and practice has typically focused on women and children's health, but not on men. The World Health Organization has occasionally embraced commentary about men and boys. However, this has usually sat at the periphery of gender equity discussions. And our report, From the Margins to the Mainstream, gives lots of examples of other research and commentaries that highlight the absence of men's health. And I think in this we owe a particular debt to the work done by Global Health 50/50 at University College London, which has been especially helpful in identifying some of the gaps. So what are the barriers? What's actually held things back in terms of the development of policies that are appropriate for men? Well, we know that in general, gender as a whole is not a priority for global health organizations. It may be talked about a lot, but in terms of action, that's much thinner on the ground. Where gender is addressed, it's usually seen to be synonymous with women. Gender equals women is the kind of well-established paradigm. Gender is often not thought to include men. We know that policymakers generally are not engaged with men's health issues, but in the report we try and understand, or we suggest some reasons why that might be the case. And we think that it's partly due to a lack of sex disaggregated data. Policymakers are often from medical backgrounds with no training in gender issues. There's been limited research into the economic costs of poor men's health, which means that the health economics is not a driver, or hasn't been a driver for action in this area. I think there's an issue about the sheer breadth of the issue. Telling people to do more on men's health, telling governments they should address men's health, really presents them with a very big agenda. And I suppose it invites the question, well, where do we start? And it also means that people can pass the buck in terms of responsibility to somebody else. And we also know that politicians haven't been engaged, generally speaking, in men's health issues. Frankly, it doesn't seem to them, I think, that there are any votes to be lost by ignoring men's health. We think there's a lack of concern for men, a lack of sympathy for men, and this is partly because men are correctly seen as privileged and powerful in most areas of public and private life. And therefore, dealing with an area that they do badly in, one of the few areas where men do badly, health, is not seen as a priority. Also, I think when we talk about men's health, we tend to position it in by focusing on sex differences, almost trying to prove that men are worse off than women. Maybe we haven't done ourselves any favours by positioning men's health in that way, because there isn't a binary choice to be made here. And I think we've perhaps lost friends and allies by trying to claim that men are the real victims, or the only victims, or the main victims when it comes to health. I think there's a tendency in some circles to believe that men have behaved irresponsibly, that they're the agents of their own destruction. If men smoke too much, or smoke at all, if men drink too much, eat the wrong foods or whatever, well, they've only themselves to blame. I think that notion is quite widespread. I think men are generally seen as a homogenous group, so we haven't focused on perhaps particular subpopulations of men who have particularly bad health outcomes. We haven't drilled down enough within the male population to identify those groups who are most at risk and in most in need of attention. And I think there's been a lack of a common advocacy agenda by men's health organisations. There aren't many such organisations anyway. I think there are about 10 countries that have men's health organisations, but they haven't really worked out a common policy agenda. That's something we're trying to do at a global level through global action. But I think that until recently, that hasn't been the case. But I think there are opportunities now for making some progress. Of course, we have the existing men's health policy platform that I've referred to, the WHO policy for Europe, the national men's health policies, and so on. We know that men's health is a much more visible issue. We may not like everything that we see in Men's Health magazine, but at least it means that men's health is an issue that's on every newsstand and is much more visible because of that. Also, Movember and initiatives like Men's Health Week have helped to put men's health on the public agenda. And there have been some issues like suicide and mental health that I think have received particular attention. We have more and more evidence now of the cost effectiveness of improving men's health. We have more evidence that it actually makes sense from a health economics point of view to address the issue. And we certainly know, we certainly have much more evidence that men's health interventions can be effective. We have some robust peer-reviewed research which actually demonstrates that. So putting money and resources into developing initiatives for men's health is not just something that's done hoping for the best. We know now what's likely to work. And then we have the Sustainable Development Goals, which focus on, among other things, premature mortality, suicide and road traffic accidents. And in all those areas, men do worse. So it's quite clear, and this is obviously what the WHO has now realised, that if we want to actually stand a chance of achieving the Sustainable Development Goal targets, we actually have to pay some attention to men's health issues. There are some other opportunities as well. The social determinants of health is an approach that's now more widely expected, and sex and gender are among the social determinants of health. The Men's Health Equity Agenda, developed by Derek Griffith and others, has helped us to identify those subpopulations of men which have particular problems and where we should focus more attention. And I also wanted to mention men's biological frailty, because in recent years we've tended to ignore this. We've tended to talk about men's behaviours, gender norms and those sorts of issues being particularly important. But I think COVID has really brought home or reminded us that men have an innate biological frailty. We know in terms of COVID that men's weaker immune response is partly responsible for their higher death rate from COVID. And some research has suggested that at least 1 or 2 years of the life expectancy difference between men and women is due to biological reasons. And I think if we perhaps emphasise that more and what the policy responses to that what the policy responses could be, we might actually generate more sympathy and concern for men. And then finally, human rights-based approaches to health. I mean, the WHO has had this in its constitution since 1948, I think. But if we believe that optimal health is an innate human right, well, that's not divisible, and it applies to men as much as it does to anybody else. So in terms of policy goals, what could we be aiming for? Well, I think we certainly need state of men's health reports. We've seen the impact of these over, there haven't been many of them, but there have been some. There was a state of men's health report for Europe, which Alan White and Noel worked on back in 2011. And although the best use wasn't made of that by the European Commission, which published it, nevertheless it had a significant impact. The WHO also produced a report on the state of men's health in Europe. It's a shorter report, but it was nevertheless a useful, which accompanied the European men's health policy. And again, that showed its value. In Leeds, the City Council published a men's health report before it developed its work programme on men's health. So we know that these kind of reports can have an impact, and they will be very useful in terms of collating information that's widely available about the state of men's health and to help us make the case. Men's health policies are clearly important, whether that's at the international, national or local level. Gender and health policies, where they exist, should certainly include men. And also, and I think this is particularly important, men's health should be included in all other appropriate policies. So where there are policies on cancer, cardiovascular disease, mental health, diabetes, or whatever, they should be gender responsive. They should include men, women, and other populations. So we make sure that all policies are gender inclusive and gender responsive. So what are the next steps? Well, it's certainly important to collate and present the evidence in terms of the men's health reports that I've just mentioned. I think it's important that we have focused demands. It's very tempting when talking about men's health to ask for everything at once. And I think we're more likely to make progress if we choose our targets carefully. And these may vary from place to place. And we should certainly be ambitious, but we must almost also be realistic. And I think one of the lessons from the work that's been done on HPV vaccination is that having a focus very specifically on that issue has enabled more progress to be achieved. And that was certainly true in the UK, where we were involved in a long battle to get boys included in the national vaccination programme. I think it's very important that we support gender equality. We mustn't be seen as making the case just for men, but for treating men's health and women's health as interrelational issues. And we should certainly, as men's organisations, support campaigns against male violence. We should support women into positions of leadership in health organisations. And we must also promote an active role for men as fathers and carers. I think it's very important that we build alliances with other organisations. We are a small sector, and I think we can add value to other organisations in their work, but also they can help us achieve our goals as well. And Rosemary may say more about this, but she's been instrumental in developing the Gender and COVID-19 Working Group. And I'm pleased to say that group has been very open to the involvement from men and men's health organisations. And I think that's an example of how men's and women's organisations can work together around a goal which is gender related. I think monitoring and evaluation is extremely important. So we know that we're making progress and the right kind of progress. And I think it's also very important that we take a long-term perspective. Noel may say more about this when he talks about the situation in Ireland, but I think it took something like 5 or 6 years for the men's health policy to emerge up from when it was first talked about. So I think we have to be patient. Policy change takes time, but nevertheless we know from the example of Ireland and others that it is achievable. Just before I wind up, just a few acknowledgements of people who helped with the report. I wanted to thank Professor Alan White and Noel in particular. They acted as project advisors and gave Global Action a lot of help with developing the report. I want to thank the 91 respondents to the 2 online surveys, the 14 key informants who spent time being interviewed. And I also want to thank Advanced Accelerator Applications, which is a Novartis company, which generously provided funding for the work on the report and its publication. They gave us an educational grant, and I think it's also important that I say that they had no influence and didn't seek to have any influence over the contents of the report and the use we're going to make of it. So that's it. It's a summary of what it's all about, and thank you very much for your attention. I look forward to hearing what Noel, Rosemary and everyone else thinks about it. So for now, that's it for me. Thank you.
Thank you, Peter. So just a quick reminder for those who may have joined late, the plan now is to have 5-minute responses from Noel, Richardson initially, and then from Rosemary. So I shall hand over to Noel.
Thanks, Steve, and well done, Peter. And I'd like to congratulate you on the publication of the report, and also just to commend you on the leadership you've shown in mobilising kind of grassroots support for the inclusion of men's health in policy for some time now. I'd also like to acknowledge the title, From the Margins to the Mainstream. I think it's grounded in a fair degree of realism. And I think it's a measure of the challenge that faces us all in this area. And I think it's a good title and is reflective of the challenges, as I said. So I'll offer some quick fire responses to your presentation and what's in the report, with a particular focus on my experience of men's health policy and implementation within an Irish context. So if I could begin by looking at some of the barriers that you identified. And one of the key barriers I think that you identified was that gender tends to be synonymous with women's health, that it's often understood in more reductionist or stereotypical ways, and we often think of men's health as John MacDonald says, as men behaving badly. So it's men engaged in too much risk behaviours or not being proactive about their health and so on. So I think that's a key challenge facing us in the sphere of men's health policy. So for what it's worth, I think policymakers and especially practitioners are more likely to both understand gender and buy into the merits of having a more explicit focus on a gendered approach to programme and service delivery by seeing the successful application of gendered approaches in practice. So, for example, within an Irish context, programmes like Farmers of Hearts, Men in the Move, Sheds for Life, these are kind of health promotion programmes based in community settings, have been critically important in getting people, practitioners to understand what gender means in practice. And I think this effectively moves the discourse away from the problem with men to potential solutions, including opportunities for situating gender within a wider intersectionality lens. So I think it's imperative that gender training or gender mainstreaming training is informed by strong evidence-based practice that strikes the right balance between kind of theory and practice in this space. Another barrier that Peter highlighted was the lack of a common men's health advocacy agenda, which I think is really important. And again, it comes back to the importance of Global Action Men's Health's role in this space. Again, if I could just highlight a few key learnings from an Irish perspective. In our experience, advocacy work for the inclusion of men's health in policy is just the beginning and needs to be sustained through to implementation, and in order to keep it there. Training and capacity building has a key role to play in broadening the advocacy network. So for example, in Ireland, our Engage National Men's Health Training Programme at this stage has trained over 1,200 service providers and practitioners who have now kind of extended the advocacy reach for men's health policy inclusion. I think that's really important. I think marketing and promotion work to keep men's health on the agenda is really important. And again, I'd highlight the work of Colin Fowler in the Men's Health Forum in Ireland in mobilising over 70 partner organisations to celebrate Men's Health Week now every year, and is doing a huge job in that work, but it's underpinned again by partnership and promotion work. In terms of opportunities, I agree that a really solid platform is there, say from the national and the WHO level in terms of policy platforms, really strong evidence base now in terms of research. And again, I think there's a lot more media profile in social media in particular on men's health. So a lot of the landscape has changed for the better over the last 10 years. And I guess we could argue at this stage about the merits of trying to push for national men's health strategies versus more gender mainstreaming approaches. But I think the key challenge is to convince national and international policymakers that men's health matters. And on that note, I think that the health economics argument is crucial. As you mentioned, Peter, the reduction in NCDs and premature mortality, emphasising that improved productivity, reduced absenteeism, etc., is really important benefit from having an increased focus on men's health. We need to work more closely with the health economists to be able to demonstrate that investing in men's health makes good economic sense, I think. I also think that framing men's health within a gender relations context is important, and demonstrating how a broader focus on men's health, including a reconfiguration of men's caring and domestic roles, can contribute to improved gender equality and moving away from perceptions of men's health being about binary choice between men's and women's health. So the gender relations perspective is critically important to reframing those arguments. In terms of the goals, but the next steps you highlight, Peter, I mean, the blueprint is definitely there, and and it provides a really good roadmap for the way forward. But I think a couple of points to make on this. I think advocacy efforts across and within member states is really important. If at an international level, men's health needs to be a priority under programs of government within the national level. And again, I think stressing the economic benefits of this is really important. And I think that's what governments kind of buy into more than some of the other arguments. Partnerships and alliances between health departments, health services, the academic institutions is really important. And in Ireland, like, we've worked really well collaboratively, say, between the academic institutions, service providers, and NGOs. So just to wrap up then, key take-home messages from my perspective, I think, would be we need a dissemination strategy for the report with a clear call to action. I think Global Action Men's Health has already forged really good alliances with other NGOs and with the academic sector. I think an important new area to extend that partnership and collaboration work will be with the political sector, with individual member states and with, say, the European Parliament and other political organisations. And as I mentioned earlier, traditionally we have focused on the cost of inaction on men's health, especially in terms of mortality and morbidity. Is it time to recalibrate this argument towards the benefits of action, focusing on things like increased productivity and reduced absenteeism? I'm sure my time is up, so I'll leave it there. Thanks, Steve.
Thanks, Noel. That's great. Without any further ado, I shall ask Rosemary for her response and encourage people to start the chat.
Thanks, Steve, and thanks, Noel, and thanks very much, Peter, for inviting me to speak today. Just to let everyone know, I'm not a men's health researcher, but I am a gender researcher, and I take a very non-binary approach to gender and very much advocate for the gender analysis within men's, women's, and gender minority health. And that's one of the sort of the approach I'm taking when I reviewed the report. And I am an advantage to most everyone on the call because I have read the report, and I would very much encourage you to have a look at it when it comes out on Friday. And I really like how the report takes a more nuanced approach to the barriers of men's health inclusion in policy. You know, it does attempt to situate men's health within power and privilege, gender norms, gender power relations, thinking about patriarchal structures, as well as women's health and well-being. So as Peter mentioned, men's health vis-a-vis women and gender minorities as well. You know, the report does have a recognition that men in power who are, you know, likely to be the main beneficiaries of male power and privilege are likely to be unwilling to take action that potentially challenges the male gender norms that underpin their dominance and the identities of men in general. And I think that is quite an interesting approach that we're seeing more of now, but really recognizing it and asking the question, why are policymakers who are majority male not interested or not paying attention to men's health and really thinking about the different reasons for that, and looking at politics and privilege as part of it. I also really like the emphasis on an intersectional approach and recognition that not all men have the same experiences. That's so important when we're doing gender work, that we recognize that gender and sex intersects with race and class and disability, etc., and that we must bring an intersectional lens to understand how different men are being impacted. We see that now with COVID, for example, with more minority men, especially in the United States, African American men being much more highly impacted than white men. I would like to stress a key point that the report also makes, that I think is really key, that taking a gendered response to any health issue, whether non-communicable diseases or COVID-19, is not a zero-sum game. You know, talking about and addressing how one group is impacted or affected does not mean that the ways other groups are impacted are not important. You know, and that we need to look at people's health and well-being vis-a-vis one another, and that everyone, and we know evidence shows that everyone is better off when we have more equitable responses and processes. You know, take the report's conclusion that there has been a lack of focus on sex-segregated data and gender analysis, and I do wholeheartedly agree with that. We see that across women's health, non-binary health as well. And I think that some of the reasons behind this include the fact that gender has historically been equated with women. And what is feminized is often devalued, you know, and a lack of sex-segregated data does take the male body and experience as the norm, you know, but we see that this also harms men. And men have unique experiences as a result of the intersection of sex, gender, and other social stratifiers. So by extension, having data disaggregated by sex and other social stratifiers, and then also analyzing the role of gender, will allow us to ensure that everyone is getting the services, support, and care that we need, and we're not taking anybody's name as the norm. So as a way forward, you know, how can we make the case best for more effective policy response on men's health? Well, I agree that increased attention to men's health is needed. However, as the report rightly states, this has to be done in a way that doesn't perpetuate and reinforce harmful gender norms, which do tend to marginalize women. You know, how we approach the issue is important, focusing on how gender affects everyone and how everyone benefits from gender equality, as well as emphasizing that not all men and not all women and not all gender minorities have the same experiences, may be a way forward to ensure that our approaches to gender are inclusive. And I really like that Peter highlighted that in the webinar today, the need to focus on gender equality. I do find the inclusion about the need to emphasize the evidence of the cost effective of improving men's health interesting. I definitely don't agree with this, and Noel also raised this. It's, you know, we have been making a similar argument, gender specialists have been making a similar argument for women's health advocates for a very long time, that we do need more sort of these, to think about the cost effectiveness, the economic impact of our interventions to try to convince policymakers to see them as important. However, you know, this does move away from the argument that, you know, it moves beyond the argument that there is intrinsic value to something. For example, that doing something because it's the right thing to do, and to make a more instrumentalist argument, which, you know, often a lot more men do find appealing. You know, I think these are good stopgaps, but do move us away from arguments about the need to change the system itself, about changing the structures and processes in which we work to ensure they are more equitable, and the value of doing something can be simply because it's the right thing to do. This is more my idealist side coming through, but I do sometimes struggle with those more instrumentalist arguments that always push agendas into what's value for money, what's the most bang for our buck. Sometimes that's not the reason we should be doing things. And, you know, these are similar to the arguments about traits that make a good leader. Those which are viewed as more masculine are often valued more. These require, and we know that these types of changes require long-term normative changes, which are not always easy, but are possible. And I think COVID-19 is providing a unique opportunity to raise the importance of gender and gender analysis, and highlighting the differential short and long-term impacts of men and women, and putting a spotlight on gender and the need for sex disaggregated data. And we really should capitalize moving forward on this. You know, we are seeing more data coming out that is disaggregated by sex, but we do have a long way to go. And COVID is really showing us how sex and gender are intersecting and impacting people differently. You know, it's showing us that more men are dying from COVID as a result of multiple factors, both related to biology and gender. But, you know, then those are short term, but also that women tend to have more long-term effects, and that we must look at all, both short and long term. We can't, and it's just by looking, not one is not necessarily important than the other. So one thing that the report didn't really focus on, but Peter did mention it during the presentation, which might be another possible way forward to help increase attention to gender, including men's health within policy, is ensuring that policy spaces are made up of diverse leadership, including by gender and other social stratifiers. So we know to this day women are underrepresented within leadership roles. You know, they make up 75% of the health and social care workforce, but only occupy about 25% of leadership positions. And we know that more diverse leadership teams produce better results. It moves us away from groupthink and ensures that diverse experiences and perspectives are heard and taken into account. And I think that, you know, that's one space that we could move on, is thinking about more diverse leadership spaces that may allow, you know, bringing in women and other minorities into the leadership space might also allow us to bring attention to gender and men's health and a non-binary approach to gender. And I'll stop there. Thank you.
Thanks, Rosemary. Yeah, I thought if I turned my camera on, that would do the trick.
It did. Thank you.
So we're getting a few things through on chat. Could I suggest that Rosemary, Noel and Peter keep cameras and microphones on, maybe, so that that makes it a bit more interactive for the question session. And so there's a question that's gone off chat, but it was basically about the particular disparities that men from poor income areas face. And the comment was actually in relation to prostate cancer, but I think it's a general point. So I guess framing that as a question to the panel would be, where do you think that would fit in terms of a policy direction?
Well, perhaps I could kick off. I mean, it's certainly clearly you know, the statement is clearly correct. We know that men with low incomes do much worse in terms of their health outcomes across a wide range of conditions. We know that their life expectancy is generally lower. We know that the social gradient for life expectancy is actually steeper for men than it is for women. So it seems that poverty, deprivation has a particularly sharp impact on men's health. And I think what it demonstrates really is the importance of taking a kind of an intersectional approach, because we also need to map these inequalities across not just kind of a couple of parameters, but across several. Because if we added race into that equation as well, we'd see that people from black and ethnic minority groups do particularly badly. So if you add being male, being black, being poor together, then you probably have a group which has, generally speaking, the worst outcomes. We certainly know that's true from COVID, very dramatically true from COVID. So I do think we have to highlight these multiple layers of inequality and find a way of actually making policymakers particularly aware of that. And we are seeing that. I mean, what COVID has done really in many ways is to highlight some of these issues very sharply. And we are seeing, certainly in North America and in Europe, much greater attention paid to these inequality issues, because they have been so laid bare, and people are quite rightly demanding solutions to them. I mean, the whole Black Lives Matter campaign has really taken off against not only police brutality, but also in the context of COVID, which had a particularly dramatic impact on that community. So we are seeing governments now being forced to be more sensitive to these issues, and I think, without wanting to sound opportunistic, that does create a window for us to try and get these messages across much more effectively.
And it does underline the importance as well of not just like using an intersectionality lens to identify subpopulation groups of men who are most in need, but how do we engage these in prevention programs and other supports, you know, that are targeted to where they're most needed. I mean, because that has been traditionally a huge challenge. You know, succeeding in getting policy initiatives to reach where they're most needed.
I think there's an interesting point that's just been raised on the chat around sort of intersectionality and inequalities, and whether a men's health policy is a diversion from that, and whether we should be trying to win intersectional battles.
So can I just come
Rosemary,
in here quick?
I'd be particularly interested to hear your thoughts, Rosemary.
Yeah, so in the gender space, we do talk about taking an intersectional gender approach, which is moving a little bit away from a pure intersectional approach, right? That with an intersectional gender approach, we're taking gender as our entry point for further understanding, but clearly recognizing that it intersects with other social stratifiers. And I agree that, you know, when we look at sort of women's health movements as well, and it's probably the same for men's health movements, and we looked at feminist movements, for so long it's been white feminism, white women's health. And bringing in that intersectional lens helps to break those boundaries. And I think the rhetoric and the language we use is so important. And that I agree that it's, and I'd be interested to hear what Peter thinks, that using rhetoric around men's health organizations, men's health, you know, while it is important, but how do we also like shape it so we're not privileging a certain type of man or a certain type of organization? And it's the same within gender and women's health, you know, recognizing that people do have unique experiences and needs.
should I come in again, Steve? I
Yeah,
think
that would be great.
this is a really important issue, and I certainly think that generally speaking, men's health organisations where they exist have been dominated by sort of white middle class professionals, male professionals like me. So this is a problem, and we need to, if we're genuine about becoming diverse and inclusive organisations, we have to look at our own structures and leadership and reflect on how we can actually make ourselves more diverse. Because it is very hard to speak to the communities we purport to represent if we don't actually represent them in terms of how we look and how we think. So that's a real issue. I think the question that has been raised about whether men's health policies are a diversion, I think is a really interesting question. I don't have a clear answer to it, but I think that certainly we know that men's health policies where they have existed, and I'm again particularly thinking about Ireland because it's the example I know best, it's quite clear that it has made a significant difference. It has really pushed the agenda forward. It's been a real catalyst for action. So I'd be reluctant to say, let's not think about men's health policies anymore, because we know that they do make a difference. And there's not much that has made a difference in our field. And here we have a concrete example or several examples of policies and interventions that have made a difference. I don't want to sort of chuck that out. On the other hand, I think that there may be, we don't want to spend a lot of time trying to make the case for policies which, first of all, we may never win, because there may be many governments which simply will never go down the road of a men's health policy. So we're actually just banging our heads against the wall and completely wasting our time and our resources by trying to win that battle. And it may be that in those countries or in those areas, we need to think about other kinds of interventions that might be more effective. And that might be focusing, for example, on a more straightforward goal of trying to make sure that mental health policies adequately reflect, take proper account of gender and including men. So, I think these are questions that need to be answered. We need to think these things through, and maybe there's different answers in different contexts.
I'm aware that time's running out. A few people have asked sort of questions about international context. There was a question about whether there's any plans to do men's health reports in Africa, for example. But there's been questions about the wider international context. And I just wonder whether we could finish maybe by getting a view from each of the three of you on the sort of local country versus international policy context. Would you like to start, Noel, maybe?
Not sure if I understand the question, Steve, actually. I mean,
So there's obviously, currently there's international policies linked to WHO and the other things that Peter's pointed out in the report. There's national policies. And I'm just wondering, for example, where you think the emphasis should be.
Well, I think the international, the work on WHO is really important, to provide a template and to encourage national countries to take a lead in this space. But obviously they can't force them to do it, or they can only advise or guide. But I do think it is important. And I wonder, is there a void between the publication of, say, WHO's Strategy on Men's Health for Europe in 2018 and any kind of advocacy efforts to make sure that filters down, to individual countries, particularly maybe less well-off countries. I'm thinking of, say, Eastern European countries, where men's health outcomes are far worse than in Western countries. I mean, apart from the launch, I'm not sure, what else happened to kind of to promote the adoption of either men's health policies or gendered approaches to health policy more broadly. So, I mean, coming back to my earlier point, I think this is why the work of Global Action Men's Health is really important, to fill that advocacy void, I think that's there at the moment, to connect what's happening in the international, say, health policy agenda, and to connect that with individual member states and to mobilize maybe grassroots organizations within less well-off countries in particular, to apply some upward pressure on governments to take more action. I don't know if that answers the question.
I'm aware of time. Rosemary, would you like to make a very brief comment? And then Peter, do you want to comment on that to finish us off?
Yeah, just a very, very brief comment. It kind of brings on with the intersectional lens that we do need diverse geographical representation as well, because the way gender impacts men's health will be different, and gender is still context specific for everybody, men, women, and non-binary health, and we do need that lens. I think this report does shine some light on some very cross-cutting issues that would be applicable across different contexts, but we do need to bring our own geographical lenses, and having some more subnational reports might be very interesting. I think Peter mentioned the work in Eastern Europe on non-communicable diseases that WHO is doing, and that's been really great to highlight the issues in the region, and I'd love to see further work in other regions on topics. And I think there was one comment I think that Jeff made about issues related to 3 streams: depression, suicide, violence, fathers, new dads. I think Peter mentioned that too. I think non-communicable diseases is another huge one. So what are these certain key streams that we should be focusing on, and can we do more regional reports and evidence on it?
Great. Thanks, Peter. Do you want to make a final comment?
Yes, well,
and then I'll close up.
Yeah, thank you. I just want to agree with the previous comments, really. As an organisation that purports to be global, we do have to make as big an effort as we can to be global. And there are parts of the world that are underrepresented in our work so far. We do have members in every continent. We have some members who are based in Africa. We have some members who are based in Asia, but overwhelmingly we're a Western Europe, North American and Australian oriented organisation. And that reflects where men's health activities have been most intense to date. But that's something that we need to look at and something that we need to change. And it's something that I'm certainly going to give some more thought to over the next year and beyond. I do think that we have to focus a lot of energy on the WHO for all its faults. It is the key organisation for us, and if the WHO globally was to make a statement or more purposeful statement about the importance of addressing men's health, and even to have some kind of gender and health policy that adequately reflected men as well as women, or which was exclusively on men, I couldn't kind of underestimate the significance of that. That would be a huge step forward for us. But in the meantime, I hope that each WHO region will follow the lead set by WHO Europe and the WHO region for the Americas in developing a work program around men's health. That will be extremely important. Can I just end by, before you wind up, Steve, by thanking everybody for participating. We'll have a proper look at the issues that have been raised in the chat after the webinar. But can I just say, from our point of view, the discussion doesn't end here. We have the second webinar in 2 weeks. But also, if anybody has any thoughts at any time about what they've heard today, or when they read the report, please do email us and let us know. What we're planning to do is to produce in the autumn a short summary of the comments that we've received, so we can take them into account as well as we develop our work going forward. So thank you very much for chairing, Stephen. Thank you to Noel and Rosemary for their contributions, and to everybody else as well. It's been really interesting. Thank you.
Well, thanks, Peter. You've just said everything that I was going to say. So thanks to everyone for joining. And as Peter says, I'm sure Global Action on Men's Health will be very keen to hear any further thoughts on the report and the conversation from today. And just thanks again for participating.